Welcome back to STL Live. Joining me today is Cindy Fears with Affinia Healthcare. Thank you for being here. You know, we've got this event coming up. You have this event coming up that's really quite important. It's taking place next Saturday. Tell me about it.
Well, next Saturday, January 30th, is the second last day that an individual can go out and sign up on the marketplace to get insurance. If the open enrollment period ends on January 31st, and unless a person qualifies for a special enrollment period, they lose their job, they get married, they have a child, they won't be eligible to enroll through the marketplace until next year's open enrollment in the fall.
Okay. So at this event, I mean, let's take a step back too. So we're talking about it with Obamacare. There's many successes that clearly have come out of this, but you go onto the website to enroll, and it's really quite overwhelming, and that's kind of what this event at its core is really to help people. There's a lot of stuff going on that day, but this is to really help people navigate. Is that correct?
Yeah, the whole part of the program with the Affordable Care Act was that it was designed to have either a navigator person involved or a certified application counselor in case the applicant couldn't figure out the website by themselves or needed guidance information about what the different plans mean. We're working with a population who have never had health insurance, and health literacy is tough. Premiums, what's a premium? What's a coinsurance, a copay, coinsurance, out-of-pocket maximum? Patients don't understand that, and so having trained and certified people, you have to take 20 to 30 hours worth of online training, a couple of hours of an ethics test, and then here in Missouri we get licensed specifically to do this through the state. And so not anyone can provide this guidance. We've been trained specifically to explain the choices to a patient. It's not just about how much you pay every month, it's how much your deductible is going to be. Is the doctor that you go to already in the plan that you're picking? If you're OBGYN, if you're a woman and you're in the middle of your pregnancy, you don't want to change to a different doctor. If you have a pre-existing health condition, you're diabetic, you're asthmatic, and you have certain medications that you use, you don't want to pick a plan that isn't going to cover that. If you like going to a certain hospital, some of the plans have certain hospitals that are in network, and if you don't go to one of those hospitals, then you have another whole out-of-pocket cost. And our patients don't understand that. A lot of times they're used to just going to the emergency room, and this provides a real structure to what they're doing. And having someone there to provide that guidance and explain what the differences in the plans are, what their choices actually are, so they make a good decision for their health and that financially makes sense for them. Is the whole goal, is not to just pick something and then drop it a couple months later because it's too expensive or you can't go to the doctor.
No, I mean, you're really providing a critical service, because even if you do have, let's say, insurance through your employment, it's hard to understand the language and the jargon, even when you have assistance sometimes. So when you're talking about having to go on your own into the marketplace to decipher what's out there, you definitely need assistance. Well, it's taking place on January 30th. We've got the information there for you on the screen. Affinia Healthcare is putting this together. It's going to be a lot going on that day. Marketplace enrollment assistance, better health enrollment, blood pressure screenings, relaxation classes every hour, free hand massages, a Mary Kay product rep is going to be there, healthy living information. This is really, it sounds like just a big, big event to get people sort of in the door to do this, but other things as well. Is that correct?
Yes, I'm glad that you mentioned Gateway. In Missouri, we didn't expand Medicaid, and that was a key piece of the Affordable Care Act. And so Gateway to Better Health is available to city and county residents whose income is under 100% and they can't get on the marketplace.
Well, I'm going to have you actually repeat that information, because we're going to take a quick break, but we're going to talk about that when we return. So don't go anywhere. We're going to learn more. We'll have more with Cindy when we return.